welcome back to Dr. U, and I'm Dr. Noah, your host. And one of the new areas that we're going to be going in, we've written a couple books. The one that just came out, but we're going to do one on autism. Is a very, very kind of disturbing type of development that's been going on here, and as we'll talk about, it's just been an explosion over the last, pretty much 10 to 20 years ago. And as we'll talk about, the medical profession is just really at a quandary what to do about it. And of course, they have absolutely, positively nothing to offer to it. And who says that? The Mayo Clinic. So just look up these websites. But they're more than happy to give the one that you're trying to take care of lots of drugs. But unfortunately, there's really as they state, no real benefit there. So autism is a kind of a disorder. Most of it has to do with the brain. It causes different types of problems with social relationships, language disorder, intellectual development. Very disturbing, very, very stressful, very demanding, and definitely a real struggle there. Well, natural things is, pretty much kind of go through the approach where let's find out what the problem is, and we'll talk about some of the problems that the scientists have found out to be able to help autism. So the biggest concern is that, there seems to be, as this quotation here from over in Sweden says, there's been a 5,000% increase over the last 10 years. And so what on earth could be going on? And so that's where we look into what's a new type of trend, because for a long time the medical profession wanted to push this, which there is a little bit of truth to this, that it's all in your genes. When you two came together, created this child, and now has this problem like that, you had bad genes, and now there's nothing to do. All we have to do is pump hundreds of billions of dollars in biotech, and then they're going to find an answer for you. Not true, but it's a nice story, and people are willing to divert their tax dollars into worthless type of research like that. The real cutting edge 21st century is called epigenetics, and that's exactly what we're going to go through here. Is that it's due to the environment, it's due to the what's happening beforehand in terms of what's taking place. So a couple different type of things that have been linked to autism, and that's what we try to do is in this study here from psychological medicine. It says they've done twin studies like that. They found that having lower birth weights tripled the risk of autism of going. Well, we know that birth weight has a lot to do in terms of both toxins, mother's health and well-being, and nutrition. We've gone over the studies showing that taking a good nutritional healthy approach is able to prevent that. Eating garbage and eating poorly can contribute to in terms of creating not only low birth weight for a child that causes autism, but other type of health problems. That becomes a real issue here. So the best ideal, which I counsel my patients do, if you're thinking about conceiving, it'd be like thinking about training for a marathon. Now, I used to do marathons. I've done in New York. I've done, Boston, Chicago, etc. I'm not going to just get up today and decide, on the spur of the moment to run a marathon. There's some training there. Having a child, which would be nice, and I know it doesn't always happen, there should be a little bit of foresight, thinking if you're going to have a child, maybe I should try doing some things that's going to provide the best type of, information to, ourselves to have that child in the best type of situation. But that doesn't always happen there. Let's see. Study characterizes epigenetic signatures of autism in the brain. Well, Archives of General Psychology and Journal of American Medical Association now has really started to come on, like I've talked about for the last 20 years, it's the environment that's the big factor. And we'll talk about some of the different type of toxins that are out there. And in a natural approach, one of the approaches we do detoxification. First, what we do is we do some testing. Now, testing is a real struggle. I have a good friend, he's got some issues like that, but we have to go out and try to find someone else that might cover these because unfortunately it's not a fair system. You can go out and spend hundreds of thousands of dollars of testing, worthless testing, and that's okay, but if you do it from a natural type of point of view, they don't cover it. So that becomes a financial restriction, as we'll talk about. That becomes a real problem with autism or with other type of health problems like that. Well, the system's designed that way to prevent you from going and looking for other type of avenues because you don't have the resources. The only resources is to come over here into the medical, surgical, pharmaceutical, industrial complex that monopolizes sickness, and then you have to stay in that area. So even the medical profession starting to understand is that the environments is really the key there, and so we have to look at the environment. And some of the environmental factors that we'll talk about here, let's see if I can find it, are things that are around you. The top dangerous things in your home. Mothballs seems to be, once again, not a big deal, but I'm still surprised. I mean, I thought only my grandmother, who passed away and lived to be 96, still had that stuff. But people do that because people don't want to have bugs, attack their clothes and stuff. Very, very toxic. Pesticides. Oh my goodness. We just talked about GMO. We talked about Roundup. All these things have been shown conclusively to be, once again, things that are going to cause bad things to happen. Autism is just one of them. Processed or pressed wood products. Been in construction, great stuff. No one likes wood to rot like that. These are, once again, wood products that are around your house that, once again, can be very toxic to you, either before you conceived or afterwards. Chemicals in your carpets. I mean, once again, degassing, very, very toxic. These things all have a negative impact on the central nervous system, and that's what autism, once again, is a result of having that insult. And so these chemicals have a factor. So God forbid you thinking about, okay, hey, I do the best I can, but I've lived my life around these things. Maybe start doing some detoxification, do some kind of cleansing would be maybe a step in the right direction in terms of both the parents and also the child that has that. Lead paint, which has been around for a while. Chemicals in the carpets we talked about. Baby bottles and BPA, phthalates, and we've talked ad nauseum on these type of things all around us. The point is that, yes, you live in this environment, this isn't to make you feel like it's your fault that now you have an autistic child or a person in your, like that. This just tells you that's where the cause comes. So what do we do as natural doctors? We have to then investigate, do the testing. What are the toxins? Take the toxins away, and good things happen. And that's what I've seen in my practice. That's what other doctors that do this, versus just coming in and giving people, as we'll talk about, drugs that have been shown not to be totally worthless but costly. Here's the financial toll burden. It's estimated that it costs $1.4 million over a lifetime to have an autistic type of child or a person in life. If you add that with, with an IQ type of problem, that jumps up to $2.3 million. Lots of money for a system that doesn't even states we have nothing to offer these people, but please give us the money, we'll come in, we'll sedate them, we'll drug them up like that so they can kind of go through it, versus having other options. And you can go on the internet, I'm citing the research here, is that for a lot of these people, and in my experience, people that had autism improved or, quote, were cured like that. So that's, once again, the discrepancy in terms of where you put your money. So toxins are a factor like that. Here's another one that talks about inflammation. In an article in 2002, Time magazine, when it still used to be a magazine, probably in a couple of years, I think Newsweek just stopped producing hard copy magazines since everything's electronic. But they had a full cover article saying inflammation is the cause of all kinds of problems. Cancer, heart attack, strokes, diabetes. Inflammation is real big. And we already talked about toxins it causes inflammation. Dietary things cause inflammation. Stress type of things of inflammation. So in this journal of immune toxicology goes over that's what you have to address. Unfortunately, what the drug companies have for inflammation, it's a real question. They give, once again, powerful type of, anti-inflammatory drugs, and the consequences are that, non-steroidal anti-inflammatories, which are drugs that deal with inflammation, kills more people than all the soldiers that died in an 11-year war once a year. So that's what you have to trade off versus doing a natural approach where you use natural things like hops and boswellia and frankincense and dietary type of changes to reduce the inflammation there. Here's the study showing that using different type of SSRIs for autism is completely voodoo, but happens all the time. Here's something that I actually talked with a patient like that. She has some brain injury. One of my specialties is I work with soldiers from Afghan and Iraqi soldiers that have post-traumatic stress disorder and traumatic brain injury. And she was saying that as of last week, she went to go see a neurologist. This is mind-boggling, saying, yeah, well, once your brain is destroyed, there's nothing to do. What? I mean, what planet or what kind of quack is this? I told her to never, ever go back to that doctor. That doctor should have his, or I think it was actually her, have her license like that. We now know that the brain can be reversed, and that's what this study here stated, that disorders of neuronal circuitry in autism is reversible. absolutely, positively. This has been known for at least 30 years, but true. When I was back in, back in the early 60s and 70s, that's what I was taught at a leading institution called Rutgers University. We were told back then, because that's what the knowledge was, yeah, the central nervous system, if that ever got hurt, that's it. Nothing can be done. Aging, as your central nerve brain destroys, nothing can be done. Nothing could be further from the truth. There's different types of different physical devices, natural devices, even drug approaches that have been shown to be helpful like that. So that's what's scary out there. And people, once again, that have these kind of disorders, whether or not is post-traumatic stress disorder, traumatic brain injury, or autism like that, they go to see these quacks. They're told like that, and they just give up. Instead of saying, okay, you're a Ford dealership. You're telling me that your Ford doesn't do what I want, but I'm going to go over to the Mercedes dealer. No, because it's a monopoly. You only, once again, hear what Ford has to say, and of course their agenda is to sell Fords. And if they can't provide you with the Ford, then they tell you a lie that there's nothing else out there. So that's why, once again, there is possibility to make changes in there. Another study here showing brain differences found in 6 months of thing. So there are actually physical type of changes. The point of this study is the sooner you start trying to do intervention, the easier it is. As things go on, the more challenging it is. I mean, this is kind of common sense. If you have a little pinhole in your roof like that, you're going to have one drop versus waiting until, once again, the whole roof is destroyed and now it's a waterfall down. What's going to be more destructive? What's going to be more costly in timing? Healthcare is the same type of way. The sooner you kind of deal with this, the better like that. But once again, as I had stated earlier, a lot of the patients that come in, whether or not it's autism or traumatic brain injuries or cancer or diabetes like that, they've been told, once again, a bill of goods that are false. And on another segment, we just talked about a new study that's showing that chemotherapy, once again, is the cancer doctors lie about the chemotherapy. It does not, once again, going to give them longer life, and that's what this New England Journal of Medical article like that. But that's the BS that's mentioned out there because yeah, they make hundreds of thousands of dollars telling you, saying, "Oh, John, if you don't, you're going to die." And we've had all the experience. I remember John having a good friend back east, waiting until 2 hours before she was going to die, and then try to make some changes like that. Well, even natural things can only go so far, but for such a long time, people, once again, are buying this lie, and the science, once again, is very clear out there that it's just a lie. But because the system is designed to continue the lie so everybody makes money, once again, this information is not readily available, and as a health provider, they're not even professional enough to saying, okay, here's my opinion. I think chemotherapy is good. That's what I've been trained with. Doctor, is there any science? No, but those are my hunches or my feelings. Well, maybe I'll go with Dr. Noah. He says there's science that says it's worthless. Because science what tries to find the facts. The hunches and things can, once again, unfortunately be because of financial background. Yeah, I'm a cancer doctor. If I don't give you the chemotherapy, I won't be able to pay my Mercedes, my 2 homes in France. So, I mean, I'm going to basically just tell you maybe it'll work, maybe it won't, but tell you it absolutely won't work. I'm not going to be able to do that. Maybe I'll have to retrain. Maybe I'll have to do what Dr. Noah says, and they're not going to do that. So that's the challenge that goes on there. This study here, women who smoke in pregnancy are more likely to have a child with high-functioning autism. Kind of common sense. In California, that's probably not as common, but just shows you, again, it's the epigenetics, it's the environment around. Now, when I was growing up, and still applies here in Northern California, we have some of the worst. We actually have, I think it was 5 of the top air polluting cities in the world. When we have different types of spare the air days, being outside is equivalent to smoking 3 packs of cigarettes. So you don't have to be smoking cigarettes, just breathing air because it's so toxic. So those are the contributing factors that create this, this child that you're going to have with we're speaking about autism, but get anything else like that. So this isn't to make you freaked out. What am I going to do? You make the steps that you can do. Things are, once again, reversible. And so that's what the science supports. And there's lots of doctors like myself doing functional medicine, natural medicine, that has, different solutions out there to help you with, an autistic type of person there. So hope to talk to you soon. Thanks.